Well, Essentia created a family advisory council as part of this initiative. Kim Kaiser explains how this group makes a difference, drawing upon their own experiences in healthcare.
The Starlight Kitchen at Essentia Health St. Mary's Children's Hospital gives new meaning to the phrase comfort food.
Your everyday kid foods, puddings, applesauces, cheese sticks, the little Lunchables with crackers, cheese, meats, etc.
This kitchen is designed just for children and their families. They appreciate having a range of options at any time of the day, especially when kids aren't feeling well.
It's supposed to offer more of a child-friendly menu than the traditional menu coming from the kitchen. Rather than having a pork chop and asparagus with fruit compote, they'd much rather have corn dogs and French fries, chicken nuggets, grilled cheese sandwiches. Is just a little more appealing.
This great idea was made possible in part by the Family Advisory Council at Essentia Health Children's Services. The group of parents meets monthly to give feedback, offer ideas, and discuss opportunities for change when it comes to how Essentia cares for kids.
Having this council shows that families' opinions matter, and they matter more than any other piece of information I think that they could get from anyone.
I truly feel that this council is making a difference. I feel like people are listening and taking our suggestions and making changes, and that we do have a voice.
Mary Jackson is also an active council member and draws from an extensive history with complex medical care for her family. She points to positive changes that have come out of the council.
Now, when rounds are made in the hospital, that parents and family are invited to be a part of those rounds, and how important that is. Because, for example, let's say something happened during the night, and you're reporting to the nurse, and the nurse is reporting. When you're part of those rounds, you can be firsthand telling them what happened if you've been staying in that room all night.
At this meeting, the group was discussing Essentia's Nurse Online service and how that can enhance care for families. They've also been exploring ways to make the pediatrics department at the clinic even more family-friendly. Both Jennifer and Mary say it's all part of a philosophy of patient and family-centered care.
Patient and family-centered care to me means that I am part of a team, that I can give my input and my input is valued, and we can discuss it as a team rather than being told this is how it will happen.
That's what family-centered care is all about. It's about making sure that what is recommended is going to work for the family, because when it doesn't work, it's not going to make the patient any better.
Parents here say they feel empowered to be part of an organization with such a positive focus on families.
It's one of the reasons why I come here. It's very important that I can be valued, and if I felt like I wasn't, then I would seek my services elsewhere. So I'm very impressed, and I like to tell people that Essentia offers that.
For Healthy Living, I'm Kim Kaiser.
What a great program. Amy, what has it been like to work with a group of engaged parents like this?
It has been a very good experience. It's very gratifying to see how willing and excited our parents are to partner with us in order to improve care, not only for their children, but for all children in our area. And they're just a dedicated group of parents. There's one gentleman who drives from Coleraine each month to participate in this group. So there's a strong level of commitment and dedication and care about this particular partnership.
Dr. Aggarwal, is it gratifying for you to get this parent feedback?
Absolutely. If you look at the patients and parents' satisfaction, that's skyrocketed since this is implemented. I think more important than that is we want to design our care processes. We want to, how we deliver the health care. I think they have to be partners with us. We want to be partners with them. We have to, embed them into everything what we do. After all, we are taking care of the children. So together is better than saying we know about how to provide care to the children rather and not you. So,
okay, Amy, what's the future for patient and family-centered care?
We are expanding this approach to healthcare throughout Essentia, so not only in pediatrics where it really took its root, but across our entire organization where we are really working to engage patients and families as partners both in the relationships they have with their caregivers, but organizationally as well, having advisory councils and mentoring programs, and really partnering in a close way with our patients and families to design our systems of care.
Well, thank you very much, both of you, for coming in tonight. An important program. Thank you for sharing it with us. Coming up on Healthy Living, a closer look at the pediatric specialty care offered at Essentia Health. Plus, a trip to the doctor can be frightening for kids. Learn how a child life specialist can help ease those fears. And then a computer program makes it easier than ever for parents to keep track of their children's health information. We'll be right back.